Welcome to HC Medic. Today we are going to discuss about pharmacokinetics, the drug absorption. So let's discuss the definition. Pharmacokinetics is the study of what body does to the drug. It has 4 steps involved: absorption, distribution, metabolism and excretion. We can remember this as ADME of drug. Now let's discuss in detail about the drug absorption. It is the movement of drug from site of administration to the systemic circulation. Let's take example of oral route, which is the most common route. We take the drug by mouth, then it enters stomach, then intestine, then it goes to the liver, and then into the systemic circulation, that is the blood vessels. And here in between, in the liver, there is first pass metabolism. Now let's see the factors affecting the absorption of the drug. It includes first, which is the aqueous solubility of the drug. Drugs which are dissolved easily in the aqueous phase are absorbed faster. Another point is that liquid or watery drugs are absorbed faster as compared to solid drugs. The concentration is also important, as concentrated drugs are absorbed faster as compared to diluted drugs, so we prefer concentrated drugs because passive diffusion is dependent on concentration gradient. Next factor is the area of absorption. The area of absorbing surface, more is the absorption. Second is the time of contact, that is the surface from which the absorption will take place must have a longer contact with the drug. The surface thickness is inversely proportional to the absorption. The vascularity of absorbing surface plays an important role, as the more the blood flow, there will be easier and faster removing of the drug from the site, and it will maintain the concentration gradient. Now we will discuss the different routes of administration in the absorption. Oral route. In oral route, the absorption will be from the epithelium of intestine, which is lipoidal in nature. In lipoidal means that only non-ionized drugs are readily absorbed as compared to ionized drugs. For example, ethanol is easily absorbed. The acidic drugs are absorbed only in the unionized when it is unionized in acidic pH, and it is absorbed in the stomach because of the acidic pH of stomach due to HCl. Next is basic drugs, unionized in basic pH, absorbed in the intestine because of the basic pH in the intestine. But important point is acidic drugs absorb majorly in the intestine because of 2 factors, that stomach is having thick mucus, and another point is that the surface area of stomach is small as compared to intestine. So majority of absorption is in the intestine, even for the acidic and basic both type of drugs. Another important point is that presence of food decreases the absorption because it delays the gastric emptying. But exception is that fatty food enhances absorption of few drugs like lumefantrine. Highly ionized drugs are absorbed poorly, so it is not effective, and we prefer other routes for such drugs. Now, degradation in GIT is seen in drugs like insulin, penicillin, which are protein in nature and are degraded by the enzymes. They are hydrolyzed by the enzymes in the stomach, in the intestine. The reason is enzymatic degradation. Another point is low oral absorption because of PGP efflux transporter, which is present in the gut epithelium. The PGP efflux transporter present in the gut epithelium. Now we will see another routes like subcutaneous and intramuscular, which have more drug absorption because the drugs are directly absorbed into capillaries, and it bypasses the first pass metabolism in the liver. The lipid soluble drugs are easily absorbed, and this is more consistent and better than oral route for many drugs. Then we will discuss about topical sites like skin, mucous membrane, cornea. In this we see local effects. Now let's discuss a very important topic, which is bioavailability. As it is very important, I have marked it as red stars. Now, bioavailability is the rate and extent of drug absorbed from a dosage form through any route. It is determined by its plasma concentration, time curve, or by the excretion in urine. The most important point is that it is the fraction of administered dose of a drug that reaches the systemic circulation. This is the most important definition. Now here the important point to be noted is the fraction. It is fraction of the administered dose in the systemic circulation in unchanged form. Now let's see an example. This is a person who has taken a drug or by oral route. Now the drug has entered into the intestine, absorbed in the intestine, and then it has traveled to liver, and this first pass metabolism and now entered into the systemic circulation. Now we see that the drug is having we give a 100 milligram dose, but in systemic circulation when we take the blood sample, it is only 70 milligram, which means that bioavailability is 70 milligram. We can say that it is 70% because 30 milligram drug is unabsorbed or it is metabolized in liver, and this is excreted in the bile. In the IV route, the bioavailability is 100% because it skips the first pass metabolism and the intestinal absorption. So IV route is best because the bioavailability is 100%. There is no drug goes wasted. Now we will discuss about bioequivalence, which means that two preparation of a drug is bioequivalent when the rate and extent of the bioavailability of active drug is not significantly different. This is important when two different manufacturers are producing the same drug. Now biologically, inequivalence of same drug is seen in different manufacturers, as I've told, or in different batches of the same manufacturer. This is due to not the active ingredient but other materials like diluents, stabilizing agents, binders, lubricants. Now the differences is in the bioavailability is not because of active ingredient, it is because of the variation in the disintegration and the dissolution rates, which is dependent on the other materials. So this was all about absorption of drug. Thanks for watching, and please do subscribe to the channel.